From chloroquine poisoning to isolation guidelines, follow Ada's tips to help with coronavirus recovery. Struck down with the coronavirus and not sure what to do? Or perhaps you're currently quarantined because you've been in close proximity with someone who's tested positive. Or you just want foresight should it come your way. The good news is COVID-19 symptoms are mostly flu-like, so you can make a full recovery even if it takes a while. On Askadatoday, I've curated some things that you can do at home to look after yourself and get back on your feet, as well as a few reminders about when, how, and who to call for help. First of all, here's a list of things that you should get ahead of time. Disposable tissue, paracetamol, any expectorant or antitussive cough medicine of your choice, immune boosters, 1000 milligrams vitamin C, lozenges, and mentholatum. If you have any underlying health issues that require monthly prescription refills, make sure what you have isn't expired, and if it's almost finished, make sure you get a refill. Also, stock up on water or whatever your favorite clear fluids are to drink. You need to stay hydrated. This is also a good time for meal prep, so make a big batch of your favorite soup or stew to freeze and have at hand. And don't forget fuel and gas. We are in Nigeria after all. Next, you have to actively protect others from COVID-19. Even if your illness is mild or you're not showing any symptoms, or you still feel strong enough to go about your daily business, now is the time to isolate yourself and those you live with. This is to protect others and stop the virus from spreading. You'd also have to protect the medical professionals during this pandemic. This is because sick doctors can't treat any patient, and the medical team needs the expertise of as many professionals as possible. The workload of health workers is on the rise globally, so limit hospital visits, speak to your doctor or pharmacist via phone, and manage your symptoms. Now, this doesn't mean that we're upset. We know that this is the life we signed up for, and we are going to help you. However, if you've got a headache, a mild stomach ache, or perhaps your child is coughing or has a runny nose, or maybe you think you're pregnant because you've missed your period for 4 weeks, which you most likely are, and I'm very sure that you'll leave, but you don't need to come to the hospital for that because you could put yourself, the team, and other patients at risk. We don't need you out here, so please stay at home. We also need you to understand that the system is overwhelmed, and that the NCDC would probably be getting a lot of calls, and that some cases would be prioritized over yours. It doesn't mean that they're uncaring. We just need you to be strong, calm, and manage your symptoms so that your health doesn't deteriorate. You see, 70% of healthy adult cases have been treated at home simply with over-the-counter meds, rest, and hydration. That's right, some people recovered without being hospitalized. However, you can intensify your calls to the NCDC when your symptoms become unmanageable. That means you've tried everything and nothing works. Treatment is really about managing symptoms as they come. Common symptoms of the coronavirus include fever, headache, tiredness, sore throat, muscle aches or pain, stuffy nose, cough, and in some cases, diarrhea. So if you have a fever of over 38 degrees Celsius, take paracetamol instead of ibuprofen. The adult dose is 1 gram. That is 2 500 milligrams tablets taken every 4 to 6 hours, with a maximum dose of 4 grams, that is 8 tablets, within a 24-hour period. This also helps with body aches or muscle pains. And remember, don't take more than the recommended dose. From time to time, you can try having a steam bath or steam inhalation if you experience difficulty breathing. Steam adds warmth and moisture to air, which can help improve breathing by loosening mucus and clearing the airways. If you have a troublesome cough, depending on the type, if it's chesty, you can use a mucolytic or expectorant cough syrup, and if it's dry, use an antitussive to manage the symptoms. Sip warm fluids to keep your throat moist, use lozenges for sore throat, and use decongestants or antihistamines for stuffy nose. For adults, 1000 milligrams vitamin C as well as immune boosters can help fortify your immune system to ward off opportunistic infections and help you regain your strength. If you're experiencing diarrhea, treat symptoms with ORS, antidiarrheal agents, and probiotics. I will also not encourage anyone to buy chloroquine or any other meds that you've seen the prescription flying on the internet. This is because most of these meds have unpleasant side effects and must be taken under strict medical supervision. Nourish yourself. It's really important that you give your body what it needs to help it recover. Fluids are essential as it is easy to become dehydrated from sweating due to the fever or from coughing, sneezing or diarrhea. So drink whatever kinds of fluids you prefer, plain water, fruit juice, herbal tea, whatever rocks your boat. You may also find that you lose your appetite frequently. Not to worry, it's a bit normal, but drinking is actually more important. And when you can eat, choose foods that are packed with vitamins and minerals so that your body can take as much as it needs to recover. Fresh fruits and vegetables are ideal. If you want to make smoothies, those are okay as well, or soups in case you don't feel like eating solids. Usually as you recover, your appetite, returns. Get lots of rest. Now is the time to stay indoors and don't expend unnecessary energy. Even if you're feeling better, you're still infectious for the next 14 days. So stay indoors, delegate as much of your duties as you can. If you want to get anything, check if there's a delivery service available. Ask your friends or family or the delivery guy to just drop it at your doorstep so you don't end up infecting more people. Avoid contact as much as possible. Thankfully, for most people, the coronavirus symptoms will be mild and recovery usually takes a few days to a few weeks. But for some others, the symptoms may last longer, especially tiredness. And that's why you need to take your supplements, your immune boosters, be kind to yourself, and increase activities gradually. Don't put too much pressure on yourself. And then you have to protect your mental health. You see, feeling ill comes with its own peculiarities. It's easy to feel anxious and negative, especially as the news and social media are filled with terrible stories about the virus. Isolation also makes you feel down and lonely, and if you're currently struggling with mental health issues, this can be a tough time for you. My advice: reach out to friends, family, colleagues, mental health NGOs, and explain how you're feeling. Read, journal, watch movies on Netflix, comedy shows, join TikTok, whatever rocks your boat, because distracting yourself during this period will help lift your spirits. Try to stay positive and remember that soon enough you'll be fine and this will all be a thing of the past. So, how do you get tested for COVID-19? Call your state hotline or the NCDC on 0800 97000010. Wherever you are in Nigeria, that's the number to call. If you suspect COVID-19, it's toll free. Stay at home and await further instructions. The state team will arrange for sample collection and transportation from your location to the laboratory. And while these arrangements are going on, remember to self-isolate. I hope this helps. For more COVID-19 updates, subscribe to my YouTube channel and share this video. Till I come your way next time, take care of your health and of each other. Bye for now.